Dental implants are lifelike replacements of missing teeth. They're composed of a titanium element, which gets placed in patients' mouths, and then we generally typically either make a crown that sits over the top. They can sometimes be linked to make bridges, so they can replace anything from one teeth to a full set of teeth. To be honest, it's for anybody who's really missing a tooth. Anybody who's probably over the age of about 21. If you've had a football injury where you've had an elbow to the mouth, you've knocked a tooth out, or where you've, over a period of time lost several teeth, it's a great solution for anybody who's sort of struggling with a broken crown, broken teeth, for patients who have sort of dentures and would quite like something that's just so fixed and solid and back to being able to use their teeth the way they used to. We have patients who've been rugby players who've lost teeth over a period of time. We've also had some of our patients who are quite elderly who have lost their teeth a long time ago and having to deal with dentures that are just rocking in their mouths. The idea of having something that's fixed, something that allows them to be able to sort of eat and chew and feel confident about going to a restaurant and being able to eat food properly, is for anybody who just wants to have their confidence back by replacing some of their broken teeth. The way dental implants are placed is a surgical process. Teeth are often taken out, and in the areas where you have missing teeth, implants are then placed, which is a little titanium screw, probably no bigger than that sort of size, get placed, and then we leave those to heal. Once they get healed, we come back about 2 to 3 months later, and then we then typically fabricate a porcelain crown that then sits into the top of the implant. Because quite often these things are designed to fit into each other. And we can either, if you've got a single missing tooth, we can place one implant. Sometimes if you have several missing teeth, we can link those implants together and make some bridges with them as well. If you've had an implant placed, it should last a significant amount of time. We're looking around about 15 to 20 years plus. If you see the dentist, you see the hygienist on a regular basis, and you're having it well maintained, there's no reason why an implant shouldn't last a significant amount of time. The things that affect an implant would be things like your health. If you smoke, if you don't come and see the dentist or the hygienist over a period of time, all those sort of things can affect how long an implant might last for. But if you look after your teeth well, if you're healthy, there's no reason why it shouldn't last a significant amount of time. So the advantage of having an implant, the biggest one is it's a permanent solution for a missing tooth. If you've had a tooth that's come out, instead of having something that comes in and out, having something that's fixed in place gives a massive benefit. Being able to help restore your confidence is also massive. Being able to then having teeth that are fixed in place, whether it's one tooth or it's a full set of dentures that you've been replaced with implants, being able to go to somewhere like a restaurant and being able to choose whatever you like to eat through a menu compared to what you felt like you might have been able to accommodate before in the past. That also leads to just being able to increase your confidence as well. Instead of worrying about sort of something that might pop in and out all the time, having something that's going to be fixed, it's one less thing you need to then worry about if it's in a social interaction or if you're out presenting to other people as well.